This flu season is hitting pretty hard. There's a complication from flu that we see in kiddos called benign acute childhood myositis or viral myositis. Flu can make you achy and uncomfortable, but viral myositis is kind of more of an extreme case that you actually have muscle breakdown. It usually happens in the legs, especially the lower legs, and especially in kind of school-age kiddos. Kids can get to the point that they can't even walk, that the pain is so bad. So in the hospital we check something called a CK level. Some hospitals use a CPK level. It's the same thing. It's a creatine kinase, which is a muscle breakdown product. We can also check the urine for something called myoglobin, and we actually do it indirectly because we do a dip for hemoglobin, which is similar to myoglobin but not the same thing. But then we look microscopically for red blood cells, and if the hemoglobin's positive but the red blood cells are like 1 or 0, then it's myoglobin in the urine. Normal CK level is like 0 to 45, and a lot of the levels that we see with this viral myositis is in the thousands, like sometimes 7, 8, greater than 10,000. We tend to admit kiddos if they're not walking on their own, their levels are really high, their kidney function is elevated, or they're not drinking very well at home. This can happen during flu or shortly after flu, and generally with pain control and hydration, it gets better in a couple of days. Viral myositis tends to be more common with flu B than flu A, and this season has been all flu A at this point. So the number of myositis cases have been relatively low, especially compared to last year, where I was admitting 2 or 3 viral myositis a day. Usually the beginning of flu season, we see a lot of flu A, and then it transitions to flu B. We are still raging with flu A right now. We've only seen a little bit of flu B. So we'll see what the rest of the season brings.